What I always talk to my patients about is liken it to a candle. And that candle is going to go burn all the way bright to the very end and then sputter out and die. Instead of having the last 25% of their lives in a wheelchair, not functional, the quality of life will be exceptional if they do a few things. It's not just any one thing, but one important thing is to get in the bed. All they have to do is go to scholar.google.com. So you write photobiomodulation, dementia, photobiomodulation, Alzheimer's, photobiomodulation, any issues regarding the brain. Look, it doesn't just help with cognitive issues. Guess what? It even helps with emotional and mental issues. The lights penetrate the skull, can get to the brain in a great way. And remember, when we're talking about affecting the body, we're not talking about adding anything that doesn't belong there. This is just an element of sunlight that has been concentrated, magnified, and driven into the body. So it's completely natural. And we're not talking about adding something that doesn't belong there. We're not talking about extracting anything that should be left in there. We're talking about this very important phrase of bringing the body back to normal, bringing the body back to health. That's what it's about. So we're actually affecting the tissues at the cellular level, even in the brain. It's about healing. What we have seen with a person with advanced Parkinson's, it was almost impossible to get them in the bed because they're so rigid, like stone. They're so stiff. And getting out after just one session was actually relatively easy. And after a series of treatment, not that many, they were able to get in and out of bed themselves, and their quality of life improves. Talking about arthritis, that within 4 to 6 sessions, within 2 weeks, they will notice a dramatic change. The eyes are very responsive. It starts on the simple thing of floaters in the eye, and we've seen those get resolved in a couple of weeks. Macular degeneration, in fact, anything really to do with the retina, phenomenal results with that. And that they have done a considerable amount of research on. Of all of us studying red light therapy, there has never been a recorded side effect. You couldn't hurt anybody if you tried. I want to live a quality life as long as I possibly can. And each of us are dealing with the genetics we were born with. You know, if you were born with a weak organ or gland or whatever, you just do the best you can with that. So you want to live as long as you can, but the highest quality of life. So you'll be dancing when you're older. And that's really what it's about. That's what we're trying to do for people. And it really comes down to how serious their issue is. If they don't have a serious issue, they'll get in the bed and they'll say, yeah, they can't see any big difference because they don't have insomnia. They don't have any energy issues. They're young, they're spry. They're not going to notice the big difference. It's the people that are really seriously having issues. And that's why if you own a convalescent home, or if you're involved in some way with any senior living facility that just really cares about their clients, put this bed in there and they will have phenomenal results.